Imagine scraping by on a fixed income as a retiree, only to face another year where your social security benefits barely budge against skyrocketing everyday expenses. That's the harsh reality hitting millions with the 2.8% increase announced for 2026. This modest boost has ignited a firestorm of frustration, leaving many wondering if it's truly enough to shield seniors from the financial squeeze. Let's break it down simply. The Social Security Administration, SSA, revealed on Friday that starting in January 2026, benefits will see a 2.8% rise, officially called the Cost of Living Adjustment, or COLA. For those new to this, COLA is like an annual tune-up for your benefits, designed to help them keep pace with rising prices so your money doesn't lose value over time. This adjustment will add roughly $56 to the average monthly payment for recipients, touching the lives of about 71 million people who depend on retirement, disability, or supplemental security income checks. But here's where the backlash kicked in right away. Advocacy groups for older adults are up in arms, arguing that this bump is way too puny to counter the real inflation eating into budgets for groceries, rent, and doctor visits. They point out that while prices have climbed steadily, Washington seems to be turning a blind eye to the daily grind retirees endure just to stay afloat. This 2026 COLA is set to sting for so many seniors, shared Shannon Benton, the executive director of the nonpartisan Senior Citizens League, a group dedicated to protecting retiree interests. She highlighted how season after season, warnings go unheeded that these slim increases simply can't cut it. Drawing from their studies, Benton's organization estimates that almost 10% of Americans at retirement age are living below the poverty line. And the actual number might be even steeper when you factor in hidden costs like unexpected medical bills or utility spikes. It's high time our lawmakers step up for older folks, or they might find those same voters staying home on election day. Benton added pointedly, underscoring the political stakes. This comes at a time when the Bureau of Labor Statistics shows overall prices have jumped 3% in the last year alone, driven by unrelenting surges in housing rents and healthcare premiums. Think about how a simple trip to the pharmacy or a utility bill can now wipe out a week's worth of groceries. And this is the part most people miss. The 2.8% figure doesn't quite match that 3% inflation rate, spotlighting a deeper issue in how these adjustments are figured out. Experts explain that the COLA relies on the Consumer Price Index for urban wage earners and clerical workers, CPIW, which tracks spending patterns for a broad group of working folks. Critics, including Benton, slam this as outdated for seniors because it lowballs the impact of inflation on their unique needs. Retirees often pour more of their budget into healthcare, like prescription drugs that can double in price overnight, and basic necessities but inflate quicker than the general average. To fix this, she pushes for shifting to the CPIE, an index tailored specifically to elderly spending habits, which could paint a more accurate picture. Her league even advocates for locking in at least a 3% yearly hike as a baseline safeguard. On the flip side, Social Security Commissioner Frank Bisignano stood by the method, noting that this yearly tweak is a key tool in ensuring benefits mirror current economic conditions and offer a solid safety net. For beginners, it's worth noting that while the formula aims for fairness across the board, it can feel disconnected from individual realities. The reveal was pushed back over a week due to a government shutdown that halted the release of September's inflation numbers, forcing the Bureau of Labor Statistics to bring back furloughed staff just to crunch the data and get things rolling again. And this announcement drops amid bigger storm clouds for Social Security's future. Projections suggest the retirement trust fund might run dry in as little as 7 years, potentially triggering automatic slashes of up to 24% in benefits, unless Congress intervenes with reforms. A scary prospect that could upend retirements overnight. Economists point out that this 2.8% uptick lines up closely with the decade's average COLA of 3.1%. But it falls short when you zoom in on how costs for essentials have ballooned disproportionately for older adults in recent times, like the post-pandemic jump in home care services or food prices. But here's where it gets controversial. Should the COLA formula be revamped to prioritize seniors' realities over a one-size-fits-all approach, even if it means higher taxes or tweaks elsewhere? Some argue sticking with CPIW keeps things consistent and affordable for the system overall, while others see it as sidelining a vulnerable group. What do you think? Is 2.8% a fair shake, or does it demand a total overhaul? Drop your thoughts in the comments below. I'd love to hear if you're with the critics or see merit in the current setup, and why.